So we're back in the second part of week 6, and I'm going to recap some of the terminology because the way that I learn is by hearing things in a bunch of different ways and then kind of processing it. So I'm going to repeat some of the terminology that we used in the first video. So it should ring some bells. If not, you can always reach out to me, or you could look it up in the text and get more info. So we're going to talk about types of sampling. Everybody asks this question: what's a good sample? Like, is it enough people if I have 10 or 1,000, or kind of what works? And then when is it good to use secondary analysis of data? And I gave a really thorough example of the Women's Health and Aging study. It was the data I used for my dissertation from Johns Hopkins about women who performed many performance-based tests, had many touch points or contact with clinicians and assessments, and I'll show you the pros and cons of that. But I've given a lot of information, probably more than you might want, but it shows you a real case study of when secondary analysis of data is really helpful. Okay, so let's begin. Again, everything we talked about last time are these probability samples that are based on random selection. If somebody tells you I have a non-probability based sample, it means they're selecting it in with a non-random way. So think of a convenience sample, or a availability sample, or a snowball sample. These are all samples that you might use for good reasons, but you can't do random selection with them. You're selecting the first 5 patients or first couple of patients that sign up and self-select, but you're not randomly selecting in that group. Again, we're not value judging. Each of these, like quantitative, qualitative, inductive, deductive, each of these have their own application and use. So we're going to flash back a little bit. The population is the term that refers to all of the individuals that have the condition or the concern or the characteristic that you're looking for. The sampling frame lists everybody in your population. They are the place that you select a sample from. So population to sampling frame, in the middle is your sample. And then again, recap, but probability-based sampling is a way of drawing a sample, right? A subset of the population, so that the sample characteristics reflect the population. Again, if the sample is representative of the population, you can generalize from the sample to the population. And that's the whole deal with probability-based sampling. You want to make generalizations and extend the findings and the things that you learn yourself in your own study to a larger group, right? It's the greater good. And again, think about, we talked about all sorts of like selection bias, right? Getting people in your sample that are healthy, or getting people in your sample that are not healthy. But you can, in the process of sampling, you can make mistakes, right? So you're doing 100 coin tosses to get a sample. You get 47 heads and 57 tails. Now, it's not a 50-50% result when we think, you know, coin tossing is an independent event. So there's some error in my sample, because in my sample, I got 47 heads and 53 tails instead of 50-50. So it means that my sample does not match the population, but it's pretty close, right? So this idea is to tell you that even if you're drawing a sample in a very methodical way, it may not be 100% representative of the population. And again, we can expect some of it, right? We're human and these things happen, but we have to find ways to avoid systematic sampling error. So random sampling error is just something happens by chance, and there's a small difference between your population and your sample. But let's say when we were talking about you want to draw a random sample of your clients, and in your sampling frame, you forgot those 5 people that joined your practice today. So you have some systematic sampling error because you've left some really key people off of your sampling frame. So if there's something that you're doing in the way that you select the sample rather than chance, that is systematic sampling error. Random sampling error occurs by chance. If we do something, forget, to include those 5 patients, or we decide to leave a hospital off of our sampling frame. So instead of 100 hospitals, we have 99. Our sampling frame is incomplete. We have systematic sampling error. And when we say random sampling, it's like saying dementia or functional ability or health status. It's a generic term. It's a large term, and there are many types of random samples that you can draw or pull or cultivate. So I'm going to give you an overview of all of these. Most of what we do are simple random sample. That's the random numbers table. Systematic random sample and stratified and cluster, they kind of add more layers, and they're more kind of elaborate sampling strategies. So let's go through these one by one. This is a simple random sample. There are too many S's for me, so you gotta forgive me. And it's what you think of, right? That you need access to an entire population, right? So if you think about it, you need to have everyone. So, and think about the random sample with your group, right? That you might have 100 patients. So you can get a sampling frame or a list of 100 patients. Here, the example is firefighters. So this researcher decides to look at firefighters in Baltimore County, and they have a list of every single firefighter. Those who retired or taken off, those new firefighters that just begun are on there. And then you use a random sample generator on your computer, and you generate to pull the sample. But again, this assumes that have every single name and it's always correct, and that for populations that are hard to reach, think about the example I gave you early on. Let's say that you're a care provider for someone who's discharged with cancer. It may be more difficult to reach care providers of people who are discharged with cancer just by the nature of care people changing, and also people being in their homes, and people being lost to contact. So you can't get lists of caregivers for those with cancer in people's homes maybe as readily. And many agencies probably would provide caregivers. So it's not always easy to get that frame. So another way of approaching sampling is you say, okay, I have a list of a population, and I don't have a random numbers table. I can't get the app. I don't have a random number generator. I'm not able to do it. So what I'm going to do is I'm going to make a list of every single name, and I'm going to choose the nth number. And I'll give you an example. So it's not representative, because if there's an ordering, if every nth case, if every 10th person is I don't know, is someone who is a new hospital administrator for some reason, and you pick every 10th case, you're just going to get a sample of new hospital administrators. So you don't want a list that has any kind of periodicity or any kind of order in which people are listed. So let me show you a real example. Here, let's say that you have a sampling frame of 1,000 cases or 1,000 people, but you only want 50 cases in your sample. So how are you going to do it? Well, you figure out what's your nth number. You take the 1,000 cases that are your total, divide by the 50 cases you want, and that 20 is your nth number. So every 20th name on that list you take in your sample. But again, if every 20th person on that list happens to be someone who's a new hire, you're going to get a list of all new hires, right? So it gives you a way to approach random sampling without having more complex, computer generated sampling lists, but it also has that risk of periodicity in the sample. And in another way that you can think about, how am I going to do a random sample? How shall I approach it? You're going to look at a characteristic that's really crucial for your study. So if you're comparing racial groups or ethnic groups or age groups or income groups, you're going to divide the population into strata by that group, right? So if you're interested in, and I'll give you an example with gender. So I'll show you with gender, but let's just say you pick a characteristic of interest, and then you're going to divide the sample amongst that group. That's going to be your dividing rod. So you're interested in looking at a sample that has representation for men and women. So you're going to take gender and you're going to divide people into, if they self-define as men and women, you're going to divide into those two groups. And then you're going to randomly pick among the group that's male and the group that identifies as female. So there is random sampling, but that first division that you do, right? That first division that you do is going to be based on a characteristic. It could be for disease categories, it could be those with low risk of disease, moderate risk, and high risk, and you divide them into 3 groups, and then you randomly sample amongst the low, amongst the medium, amongst the high risk. So you are random sampling, but there is a selection first. And I'll show you ways that you can make your sample either match, be proportional to the population, or not. So here, let's say we're interested in gender. So we're dividing groups into women and men. Those are our categories. And you can see in the first graph here, in the first bar chart, that the population and the sample are proportionate. So we have the same percentage of women in our sample that we do in the population, and the same percentage of men. So our generalizability quotient is really high. We're like, yay, we can generalize. But you can also say that, in this population, there are way more women, and I really want to understand what's the health effect of this condition upon men. So you can make a conscious choice to say, I want to overrepresent. I want to make a non-proportionate sample that overrepresents the number of men, the percentage of men in the sample, so you can compare these two groups statistically. So you make this decision. Do you want your sample to match the population values? Or for some reason, do you want to overrepresent an underrepresented group? And in this case, it's men, so that you can do statistical analyses. And that's up to you. So you stratify by the condition of interest, and you decide if you want the sample to be proportionately matching or non-proportionately. And here is the same example. So we have the firefighters. Remember, we did the random sample, the simple one. We had the list. We we wanted 100 firefighters. So we used this statistical software, and we pull the sample. Here, you have the list of firefighters in Baltimore County. 65 are professional, 35 are volunteer. In a proportional sample, 65 are professional and 35 from the volunteer group, right? If you look at a stratified sample that's equal, you don't care that much if they are volunteer or professional. You're actually going to divide it and get 50% of your sample as professional and 50% as volunteer. And you could argue and say, I'm really interested in the voice and understanding what's the difference of being a volunteer firefighter. So your rationale of doing this stratified or equal sample is you really want to bring in more of that information. But when you do that, you can also then in analyses, you can retrofit and make this stratified sample the percentages look like your population, but that's later on. Right now, just think, you're bringing in more of an underrepresented group, but then when you do statistical analyses, you can actually manipulate it so that that sample does have the same characteristics as the population. And then cluster. If you think about this, the sites that we study do exist in clusters. So in the firefighter example, there would be firehouses. For us, there might be hospitals or clinical practices. There might be schools. There might be organizations that work with older adults, organizations that work with children that are pre-existing. So I might not know every single name of providers that work with people with traumatic brain injury in Baltimore County. I may not know every single name of a person, but I may know the healthcare centers that specialize in it. I may not know every provider who is qualified to deal with long-term COVID symptoms, but I know the existing long-term care COVID centers in New York City, right? So you have these existing clusters or groups or places that really make it kind of convenient to make them your starting point, right? Like in stratified sampling, you pick a characteristic of interest. In cluster sampling, you pick a geographic setting that lets you kind of begin sampling. So you have that cluster, and then you don't need a sampling frame. You're going to randomly pick from within those clusters. It's not as representative, but you know what? When you're looking to get a sample, it's a difficult process. So if you have a network of agencies, groups, organizations that are work with the topic you're interested in, you can cluster sample from within their lists of clients or their lists of providers or whatever you wish to seek. So I'm going to give you an example of schools, right? So if you want to look at your end result is, you know, students in school, you want to pull that sample. It's very difficult to get the names of every single student in every single school, right, in the US. So you might want to narrow it down and say stage 1, here's my first cluster. I have states. I pick a state randomly. Then I pick some cities randomly within the states. Within those cities, I randomly pick some schools, and then within the schools, I randomly pick some students. Now, this is helpful because we can find these clusters very easily. The problem is every time you see this arrow, there's a point for error, right? I can make a mistake. Maybe I forgot to put a state, or maybe I didn't list all the cities, or maybe I forgot a charter school or some school, and then maybe I didn't check the updated roster of attendance, you know, for students. So each of these points that we're jumping through, cluster to cluster to cluster, although it's easier to get our sample, it's also a point of like layered error. So error could happen here, 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 right? The more times we touch the sampling frame, the sample, the more times we can introduce error. So here's an example, right? I'm interested now in, again, you know, firefighters, right? And so I get 5 states. I get 2 counties randomly from each state. Within each state, I randomly select 1 fire station. And then within the organization, I can randomly choose firefighters within that organization. So again, each bias is as we go through each step. And also it's a bit less representative because of all the steps and all the decision-making we're going through. But think about the utility. Cluster sampling is really helpful when you have naturally existing groups. I want to study support groups for people with laryngectomy, right? Where am I going to find that list? I can go to a cancer organization and I can get a list of support groups. I can randomly select those, and within the support groups, I can randomly select subgroups, right? You can do that. So it's what's feasible. And this, if it's helpful, keep it. If it's more confusing, please don't. It just shows you here, simple random sample, everybody has an equal chance. Systematic, you start at every nth, right? 1, 2, 3, 4, 5. 1, 2, 3, wait, whoa, should be 1, 2, 3. There should be 3 between each. They're spacing 3. So you see this idea that it's a systematic pattern where this is less patterned. In stratified, you're dividing amongst 2 groups and then randomly selecting within the 2, and then cluster. These are the geographic areas, and then you're selecting within those. So the samples look different. right? And the process is a bit different, but they're all trying to understand how we make our sample like the population so we can generalize, or if it's different, that we're aware of it. And now we're going to switch. So we did probability-based sampling. Now we're doing non-random or non-probability-based sampling. And I want you to think about this. A lot of people think, oh, then I can't use it. But sometimes it's the only way we can get information, right? We don't know the probability of selection because there's no sampling frame, and we may not be able to generalize results. So the question then becomes, why would you use it? Well, we use it in many cases. Let's say I'm interested in the experience of people with HIV during the COVID pandemic, right? Some general question. Where am I going to get those statistics? Where am I going to get a sampling frame of those who are both HIV positive and have COVID? You know, there's no sampling frame. These data are protected, right? Or at least HIV data. So we need to do maybe a convenience sample or a snowball sample where we access some people who self-define in those conditions, and then they might recommend other people so we can get people in the sample. There's sampling frames of people that are not always available, right? If we're looking at people that leave a practice, right, or leave a hospital, we can't always have a sampling frame of every single patient that has left, you know. So we may want to reach out and find other non-probability based ways to sample them. And here, there are many different types. These are some. Homogeneous sampling, or people who are very similar. So, you know, any characteristic that keeps people the same, you might want to sample that group. Criteria is like you want to have some eligibility criteria that people have to meet. So I'm doing a study, I'm looking at relapse, post-treatment, rehab treatment, and my criteria are that to be in the sample, you need to have gone through rehab and relapse twice. Snowball sampling is basically you interview people and you ask the person, is there anyone else you know who might be interested in this study? Because sometimes we can't have access to populations and we really want to get people who are in those shoes. I had a student who looked at spouses of those with dementia who, you know, were considering placing their partner into care. There's no sampling frame. So she would ask somebody and say, do you know anybody else who's in the same or similar position? They use purposive sampling. And basically, it just means that people are selected because they have knowledge, or they're an expert, or they know about the organization. So you're picking them because you really think that they would be a good source of knowledge or information. And that's the key, right? So that's why you're doing it. You're picking them for that reason. If you randomly sample people, you might not get people who knew about what you're studying. And this is I guess one of the major dilemmas or the major concerns about sampling. In quantitative samples, this idea is that your sample mean should approximate the population mean, right? The population mean is 39 years old in this group. Here we have a sample mean with 3 people, the sample means 37. Here's 3 people, the sample means 34. Here's 3 people, the sample means 46. These small samples, the sample mean is a little bit away from 39. When we have 2 groups here, they're 8. If a larger sample size of 8, here the sample mean is 38. Here the sample mean is 41. And we can see that the larger the group, the sample mean tends to more approximate or be close to the population mean. These means are smaller, these means are closer. So it's a rule of thumb. In quantitative, right, when we do quantitative, collect quantitative data, surveys, right, quasi-experimental design, all of those things, we determine the sample size ahead. Too few people, you won't be able, later on, we'll talk about statistical testing. You won't have enough people to do the test. You won't have enough people to answer your question. And if you have too many, you're wasting resources, and it's not going to help you with your statistical analyses. And think back, right, within the diagram that we had. So if you have a larger sample, you expect that the sample estimate should be very close to the population value. So whenever you see a confidence interval that's smaller, you know that the sample will be more close to the population. And you probably also know that the sample is larger. So anytime you see this, look at the distance between these numbers is small. The distance between these two numbers is greater. So I would say that this, right, is a smaller confidence interval because the sample size was a bit larger. And we would then infer that that sample is closer to the population. When you see large intervals, you wonder what's going on amongst all those numbers and data. And here's a visual example that we're looking at the total population, and the average age is 39 years. And when we have samples of 3 people, 3 from the 20, look at how the confidence intervals are spread all over the place, right? There's a wide width of interval. When we draw samples from the 20 of 8 people, we see that these confidence intervals are smaller in, right? So the larger we draw the sample, we have increasing confidence that the statistics we have in the sample really reflect the population. Right, so these guys are like in sync, right? They're in tandem. Here we have smaller samples, but the confidence intervals are all over the place. Now you could take a whole course on this. I don't expect that you're going to know how to estimate a sample size. It's quite difficult, and we do it now. I mean, I think we almost always do it. It's computer generated, so you could use some. There's like G-Power, all sorts of like fun named apps and platforms where you enter in some factors and then it'll tell you what your sample size is. So you want to know how many cases, how many controls, and then what kind of test you want to do. So just think about this now. If you want to do a t-test or regression, or you want to do, some odds ratios, you click in all of the options that you want to do. And then at the end, the software or the app will tell you, in order to successfully complete these analyses that you wish to perform on your sample, you need to have 500 people or 200 people. And that is taking into account all of the different criteria about your research. So I don't expect you'll fully get, the testing and all those kind of things, but know that it takes in important elements of your research design to generate a final number. And the reason why we care so much is we don't want to make mistakes, right? If we don't have enough statistical power, we are in trouble, right? We could accept something that's not true, or we could fail to recognize a finding that is true. So you want to get with power, you want to say, what are enough people that my statistical test that I'm using, my t-test, my regression, whatever it is, that it can detect real differences. These are the errors that happen. If you have the wrong sample size, you may get a type 1 or an alpha error, and it says there is a difference, but there isn't, right? So it's a false positive. So it's confirming a result or a finding, and you may say, this intervention shows that it works for people with traumatic brain injury, and it's been successful, and here are my data and my statistics, right? But it's not. So you may propagate and talk about some result of your findings that really is not significant, or there isn't a difference, but you say there is. And Oh, I switched it. Sorry. I always do it. I switch alpha and beta, so I understand if you do. Type 1 is an alpha error, right? You say there's a difference and there isn't. Exactly. So please, what I just said is correct, that you generalize these results, you say this TBI protocol works, everybody's using it, but guess what? Your data showed nothing, right? It was an error of not having enough in your sample. Or the beta, the type 2 error, says there's no difference, but there is. So you take that same TBI protocol and you say, you make a type 2 or beta error and you say, there's no difference, between this protocol and any other protocol with TBI rehabilitation, traumatic brain rehabilitation. But actually what you found is there is. So there should have been a finding that said, yes, this protocol works and does significantly impact TBI rehab, but you're saying there isn't, right? So false negatives and false positives are bad. So you want to make sure you have enough people in your sample that you can make sure that the findings you find are true. And this is a visual depiction. And people think, right, like you need to definitely have a large sample size, and if you don't, you can't find anything, and that's not necessarily true. You need to have enough people in your sample that it's representative of the population and that you can statistically perform tests, but you also have to keep it in the confines of what you can afford to cover. So you use one of those you use an app, or you use one of the platforms that can produce the sample size you want, and that's kind of your goal. You can shoot for a few more cases, but you don't want to go, if your adequate sample size is 100, you don't want 200. You can do 115, but you don't want to double your sample size and use your resources. And qualitatively, it's much different, right? It's not about the way that you kind of figure out if your sample size is enough. You do it by saturation. So it's not that you may not even begin with the preconceived number of people, but you're hearing the same story. Everybody's telling you, this is my experience with what it was like being a practitioner during COVID. And people are telling you the same narrative. They're telling you the same stories. And you pick people from different places. You're trying to get different stories. When all the themes that you get are similar, that is called saturation. So samples can be smaller. It can even be one case in a phenomenological study. If you're looking at, the experience of, and I had a student do this, of a long-term care director, working through COVID. That's enough, right? That one person is enough because you're doing a deep dive into their experience. So the analogous part for power in qualitative sample size could be saturation. And the last piece I'm going to leave you with is secondary analysis of data. And what it is when you yourself don't collect the data, but these data, they exist somewhere. So I may not have time to collect a large data set. I may not have the money to do it, but I do need these data, right? Sometimes you won't know, like the disadvantages, you won't know how somebody else collected their data set and kind of where kind of the wonky parts are. And the things you're interested in might not always be there. So you're reanalyzing someone else's data for your own purpose. A lot of times in practice, we do it with private data sets, right? So I had a student who looked at ankle injury. She was very interested in ankle rehabilitation. And she worked with an orthopedist who was well known in the field. And through conferences, they had this large data set of practitioners who did this one particular procedure on people's ankles. So they would share it, right? And then use the data to do analyses. We often do, years ago, we used to call it chart review, right? Clinical record review. We have a lot of information, especially in electronic records nowadays. You can just dig in and learn a whole bunch of stuff, right? But getting access to them, de-identifying people, just as they're a wealth of information, they're also a dearth of information, meaning they may not be complete or they may not be consistently coded. But other sources of databases are like Medicare, Medicaid data, hospital insurance data, healthcare system data. You can pull them. We have a whole bunch of publicly available data sets. For every condition, almost every condition, you can get some publicly available data. And the last thing I want to bring to you is, this is a study that I used for my dissertation many years ago, but it is a secondary analysis of data. It was a random age stratified sample. So we stratified people by age group, 65 to 74, 75 to 84, 85 plus. Within those strata, randomly sampled women. Was funded by NIA, National Institutes of Health, and Johns Hopkins, our neighbor. People, again, eligibility, they had to score 18 on the mini mental exam, which some people think is a high or low score, but they had to pass a mental screener. They had to have difficulty with the task and mobility, exercise tolerance, upper extremity ability, ADLs or IADLs, and they had to complete these 39 performance-based tests that were conducted by a study nurse or interviewer. The reason I chose this data set is, again, I often talk about it. I could not, for the life of me, get 1,002 women and myself do 39 performance-based tests. The cost of the tests, the cost of the technicians and the skilled people to run them, the cost of moving people back and forth through these testing facilities would have been astronomical. And that the performance-based tests were done with standardized instruments and certified trained observers. Performance-based measures are different than self-rated. And this study also used an age-based measure for depression that was really important to me. It wasn't a generic depression screener, it was for older women. And in this sample, we talked about how the sample is non-representative of the larger population, right? In this sample, the stratified sample, there was a oversampling of women who were African American and those who were 85 plus. So we had a larger percentage of women in the 85 plus and a larger percentage of women who were African American. And both the distribution of income and education varied. And this is the disadvantage, right? That the sample size for all the tests, although the women had to do them, really varied. So for this, rise from a seated position or the lifting or some of the more dexterous tests, data was missing. The questionnaire that they gave the women didn't match the code book or the description of the tests that were given to me. And there was a lot of turnover of data collectors, right, over the course of the study, which could mean that people might be coding things a bit differently. So again, why did I do it? Those 39 measures are great. Having those observers, I went backwards, sorry. But you can see why, right? There's no way that I feasibly could have gotten that. So in summary, right, think about, do you understand the different applications of all these probability-based and non-probability-based samples? How do you get the number for a sample? How do you reduce the amount of error in a sample? And how can you get the sample that you select to really match the population? So I'm going to leave you with that. I hope that it was a quick overview, but I hope that it gives you a good lens on thinking about non-random and random samples. And I will see you all on your exam and in your next quizzes.